How do you interpret osteoporosis screening results? Interpreting osteoporosis screening results can seem overwhelming, but it is essential for understanding your bone health. The primary tool for screening is a dual-energy X-ray absorptiometry scan, commonly known as a DXA scan. This scan measures bone mineral density, which is crucial for determining your risk of osteoporosis. The results are primarily conveyed through a value called the T-score. The T-score compares your bone density to that of a healthy young adult of the same sex. A T-score of -1.0 or above indicates normal bone density. If your T-score falls between -1.0 and -2.5, you are classified as having low bone mass, also known as osteopenia. This means your bone density is below normal, but it is not low enough to be considered osteoporosis. A T-score of -2.5 or lower is diagnostic of osteoporosis, which signifies significantly weakened bones and a higher risk of fractures. It's important to note that if you have experienced a fragility fracture, which is a fracture that occurs from a fall from standing height or less, this can confirm osteoporosis on its own. This means that even if your T-score is in the osteopenic range, the presence of a fragility fracture indicates bone weakness that warrants a diagnosis of osteoporosis. In addition to the T-score, healthcare providers often use fracture risk assessment tools like the Fracture Risk Assessment Tool, commonly referred to as FRAX. This tool estimates the 10-year probability of experiencing a hip fracture or a major osteoporotic fracture. FRAX takes into account various clinical risk factors, including your age, sex, weight, height, history of previous fractures, family history of osteoporosis, smoking status, steroid use, rheumatoid arthritis, and alcohol consumption. If the 10-year risk of hip fracture is 3% or greater, or if the risk of a major osteoporotic fracture is 20% or greater, treatment is generally recommended. When interpreting your screening results, it is crucial to consider the entire clinical context. This includes your risk factors, any history of fractures, and other health conditions you may have. If you are diagnosed with osteoporosis or are at high risk, further evaluation may be necessary to rule out secondary causes. These could include vitamin D deficiency or parathyroid disorders, which can be assessed through laboratory testing. In summary, interpreting osteoporosis screening results involves assessing the T-score from your DXA scan, recognizing that fragility fractures can confirm osteoporosis regardless of the T-score, using tools like FRAX to guide treatment decisions, and considering additional tests to identify any secondary causes. This comprehensive approach aligns with current clinical guidelines and helps ensure you receive the appropriate management to reduce fracture risk and maintain your bone health. Always consult with a healthcare professional for personalized advice and treatment options.